My name is Peter Derman. I'm a minimally invasive spine surgeon. There can be a lot of overlap between neck problems and shoulder problems. Frequently, shoulder pain will radiate up to the neck and vice versa. Neck pain can go down to the shoulder and even beyond into the hand. And it can be difficult for patients and even physicians sometimes to figure out where the problem is coming from. I would say just a couple kind of pointers if you're trying to figure out what's going on. Shoulder pain rarely radiates to the elbow or beyond. And so if you have pain that's radiating all the way down your arm to your hands, especially if it's associated with numbness or tingling, that's more likely a pinched nerve in your neck than a problem with the shoulder itself. To complicate things further, you can also have pinched nerves elsewhere in your arm, like a carpal tunnel syndrome, which a lot of people have heard of, and that can give you numbness and tingling in your hand. So it can get hard to parse these things out, and honestly that's why you need a physician that's really adept at doing these things. But I would say neck pain that's in your neck is probably your neck. Pain that's isolated just to your shoulder is mostly a shoulder problem, but obviously there can be overlap. A couple other things you can think about: pain that's worse when you reach up, pain that's worse when you reach behind your back. That's usually a shoulder problem rather than a neck problem. And so that can kind of help direct you of where to go first if you're seeking treatment. So there's a number of things that we can do to help parse this out and figure out where the symptoms are coming from. The first is really listening to patients, and there are some certain cues that cue me one way or another. So people that say, oh, it really hurts my shoulder when I sleep on that shoulder, that's usually a shoulder problem, like a rotator cuff problem. People that say it's worse when I reach over my head or behind my back to put on my seatbelt or something like that, that's often a shoulder problem as well. And then there's some things that cue me to neck as well. So really listening. There's the physical exam. So every single patient that sees me for their neck, I investigate their shoulders and I look at their upper extremities as well to see if there might be a problem elsewhere that's masquerading as a neck problem. Because the last thing you want to do is miss something like that. And then there's imaging, obviously. So I take x-rays. If necessary, we get MRIs. And then there's, even beyond that, there's nerve studies that we can do if there's any confusion at all. Some injections can be helpful from a diagnostic perspective. So if we do an injection, say, into the shoulder and your shoulder feels better, then it's probably your shoulder. Or if we do an injection into the nerves, for the nerves of your neck, and that helps you feel better, that helps us solidify the diagnosis. And then based on those things, we decide on how to treat you.